Dr. Cathy Barnett. I'm a veterinarian in North Carolina. I've been practicing for 13 years since graduating from the University of Florida College of Veterinary Medicine in 2006. And I'm here to talk to you today a little bit about arthritis in dogs. So if you are like a lot of owners of older dogs, you might have noticed lately that your dog is just kind of having a harder time getting around. Maybe he's a little bit slower to get up off his dog bed. Maybe she can't jump up in the car without you giving her a little boost. A lot of those things that just kind of happen as dogs get older. And unfortunately, a lot of owners attribute that to just getting older. Like I said, people say, oh, well, my dog can't jump up like he used to, but it's because he's getting old. And to some extent, that's expected, but that doesn't mean there's nothing that we can do to help. So in a lot of dogs, when they start to slow down like that, they're actually experiencing some degree of arthritis or joint disease. And that happens just like it does in humans as joints get used over a long period of time, especially if there's some issue in that joint and things don't line up quite right. Changes can happen in the joint over time. So basically in your joints, what you've got a bone and another bone. In between those bones, there is a joint capsule. So there's joint fluid that sits in there. Each of those bones is also covered by a layer of cartilage. So you've got bone, cartilage, joint fluid, more cartilage, and then another bone. And so over time, the cartilage can wear out, the bone underneath the cartilage can weaken, changes can happen to the joint itself and the joint fluid, and all of those things contribute to that thing that we call arthritis. So what can we do to help our dogs with that? It's actually a lot of things. By far, the most important thing that you can do to help your dog is to make sure that your dog stays at a healthy weight or actually a little bit on the lean side. So when we've got a dog with arthritis, we actually would rather them be a couple of pounds underweight than a couple pounds overweight. And there's a couple of reasons for that. First reason being that obviously the more weight your dog is having to carry around, the more pressure that it is on the joints. So think about you as a person. If you gain 50 pounds, it's going to be harder on your joints. So if your dog gains even just a few pounds, that can make a big difference. Second thing is we actually know that fat itself releases certain chemicals that promote inflammation. So just being overweight can actually make your dog more likely to have issues like arthritis. So first thing to do by far is try to get your dog to lose a little bit of weight, unless your dog is already skinny. But try to get your dog to a healthy or actually slightly lean body condition. So that's the first thing that you can do to help. Second thing is activity, but the right kind of activity. So I don't mean like, hey, let's go start training for a 5K with your dog, but take your dog for walks. Maybe not like mile-long walks, maybe just a walk around the block, but keeping your dog moving and building up the muscles around the joints can actually take off some of the pressure in the joints. Swimming is an excellent exercise, so if you have access to a pool or a lake or something like that, that's ideal. But like I said, walks, maybe, just encouraging your dog to take slow, casual walks can be enough to help build up some of that muscle. Third thing that you can do is there are nutraceuticals, so nutritional supplements that you can try. So glucosamine is one that has been used a lot in dogs and in humans. So although studies are kind of on the fence as to how much help it provides, I will tell you that on my own patients, I see a lot of benefit with it. A lot of clients start glucosamine and a couple of months later they see a benefit. They feel like their dogs are getting around better, their dogs are moving around better. So the idea is that it actually helps cause changes in the joint fluid, in the cartilage, and potentially in the bone below the cartilage too. So glucosamine can be a huge help in those dogs. It's not going to work immediately. Usually takes about a month or two to really see a benefit, but I would absolutely start that if your dog has signs of arthritis, because it's certainly not going to hurt and there's a very good chance that it will help. If you've tried all those things, so you have gotten some weight off your dog, you've tried gradual activity increases, and you've tried glucosamine, and your dog still isn't doing better, there are medications that your veterinarian can provide for your dog. With those medications, usually we want to do some blood work first just to make sure that your pet is overall healthy, and then we'll usually monitor blood work while pets stay on those medications. But some dogs do need to be on medication long term. So if you've tried those other at-home tricks and your dog isn't getting better yet, just ask your vet and they can talk to you about options.